Welcome, everyone, to the Everyday Experts podcast. I am your host, Bobby. I am here with my faithful co-host, Heidi. Hello, Heidi.
Hello, hello.
Yes, thank you. That's on-brand Heidi introduction.
Hello.
Yeah, perfect. Mrs. Doubtfire is here. We are joined today not by Mrs. Doubtfire, but by someone marginally better. His name is Jordan Ricks. He is going to be our expert today in mental health and mental health awareness. I always get his job title wrong, so I will let him take it from here and explain what he's currently doing, and then we can jump into a really important discussion that people need to hear about related to mental health. But Jordan, thanks for being with us today.
Thanks for having me, guys. Yeah, I was glad to be here. So my job title currently is a clinical research coordinator. So when studies get approved by review boards and all that fun stuff, then I'm one of the people in the white coat bringing people back for the study. You know, if they're taking medication for the study, if they just need to have a blood draw, things like that, then I'm kind of the face of the operation. There's doctors above me. I'm not the big wig, but that's kind of the gist of what I do.
Okay. Do you carry a clipboard?
Not anymore. There was an incident that I don't really want to discuss.
So willing to share a lot, but not
Yeah. My father was murdered by a clipboard.
I'd rather not discuss it on this podcast.
Yeah. Awesome, man. Well, if you had a clipboard along with the white coat, I would trust literally everything you ever said. So
That is an actual research study.
yeah, just keep that in mind.
How long have you been there?
Just over a year. So
Okay.
my anniversary was, I think, the 16th of August. So,
Okay.
yeah.
And before that, do you have a history of working in the same field other places, or?
Actually, no. So that ties into why I'm an everyday expert on mental health in
Okay.
general. My last job before this one, I worked at the local acute psychiatric and mental health hospital here in town. I was one of the intake coordinators.
Okay.
So when folks came through the door looking for some type of treatment, then I was one of the people who would do the assessment with them and then field with the doctors to get that recommendation for their level of care.
Okay.
Okay, excellent. Well, again, Jordan, you kind of segued us right into the topic. That was fantastic. We are talking today about mental health, and to be completely honest, this is one of the topics that I was most, I don't want to say excited to talk about, because, you know, mental health issues or awareness is not like exciting, but I do think this is something that people don't talk about enough, and they are starting to talk about it more, but
Agreed.
it's super duper important and really not talked about enough. So we
Agreed.
didn't want to lead off with this topic, though, because we didn't want to give people the perception that this was a mental health
Podcast. Like, it's not
only.
all about mental health.
Yeah,
but-
we definitely want to talk about that subject. But yeah, this was one of the ones, though, that I really was genuinely excited to start a dialogue about.
Yeah,
And that's why you're here.
I'm happy to settle for top 5 as far as first appearances for the episode. So.
You're a founding member.
Yes.
So you already told us a little bit about your background in mental health as far as your career goes. Again, as much as you feel comfortable sharing, can you tell us a little bit about your own mental health journey? Love to hear that.
Absolutely. So just a little bit more background too, not to overtake your question. But I have a bachelor's degree in psychology that I graduated from 10 years ago, give or take. And my master's degree is also, I did a concentration in applied behavior sciences. But even before grad school started, mental health started kind of going downhill. So my wife and I had a rough few months. I had started a job not even 2 weeks before our wedding. I had left a place that wasn't so great for me and started a new job. And literally day 5, so start on a Monday, wake up on Friday, our apartment's flooded.
Oh,
Mm.
no.
And it's so high that the cars are totaled. We have like
man.
wedding decorations in the spare bedroom that are on the floor, sitting in water. You know, there's all that kind of stuff. So that was not a great moment for us in general. So that was kind of the start of it for me. But just those first few months in general, there was a few other things too where, you know, like a lot of newly married folks, we ran into a couple financial issues here and there. Even though we got out of our lease for the first apartment and moved to a new one, that one almost flooded like a month after we moved into it. So that was a lot.
Wow.
And yeah, I just, on top of that, I was working, this new job was on second shift, so I wasn't even seeing this lovely new wife of mine as much as I wanted to, nor the friends that we had. I wasn't seeing them very often, so it was just kind of a lonely time on top of being just a lot of life changes that were not all bad, but were just a lot on top of one another. So,
Definitely, yeah.
and I just still remember, like, one afternoon, it's about lunchtime, and I'm trying to find something to eat before my shift, and I open the freezer door, and I just kind of look in there, and I just close the door, go lay down, and just bawl my eyes out. Don't even know for how long. Just complete breakdown. I stopped crying long enough to call into work and to call my wife and kind of like just let her know, hey, something's not right. And, she kind of dropped everything, bless her heart, and I came home, and after a little while, she just kind of asked me just point blank, like, do you think you might be depressed? And yeah, I was like, I think so. Yeah, I'm very fortunate, not only because we had the means to do something about it, but also because of that education that I had. I already had that background in psychology, and I've had friends growing up, like, in high school that had their own struggles, and I couldn't relate to it quite necessarily, but I've always just been an empathetic person in general, so it's always been something I've been aware of from just hearing them talk about it. And we also had a therapist that we'd seen just for, your run-of-the-mill premarital counseling, so I already had somebody that I could reach out to, and thankfully they had openings for me. So
you had that background, you had that training, but I feel like it's very hard to see that kind of thing for yourself. Like,
yes.
You see it in other people, you notice that other people are struggling, you're there to help them, but helping ourselves is really hard sometimes because we just don't see that on ourselves.
No, I'm so glad you said that, because like it was like that, because even if you know what the signs look like, which a lot of people don't, and we can get into that later, I was having all the telltale signs, but I was making excuses for it. Like, oh, I'm not playing my video games as much, or I'm not watching TV as much, or I'm not, looking for new comic books, or whatever my hobbies
just
were.
Feeling stressed.
Yeah, I'm just, I don't have the time for it because now I'm on second shift. Well, that doesn't make sense. There's the same number of hours in the day.
Right.
I'm just working at a different set of them,
Right.
But, you'll kind of rationalize anything when it's yourself, but when it's somebody else that you love, you can kind of pinpoint it. And so thankfully I had somebody like that in my wife to say, like, I think you might be depressed. So that's kind of how that started, and went to therapy pretty steadily for the first few months. And after 3-4 months of it, I'd started to feel quite a bit better. And my therapist was needing to take a break for like family reasons anyway, pretty shortly after that. But I started applying to grad school and kind of get that whole process started, studying for the GRE, and a lot of those kind of signs and symptoms start kind of creeping back. So I kind of jumped right back into it after that. So, and that's one of the important things too, is people don't always realize it's not always just like some straight shot. Like, you start at the bottom when you hit rock bottom, and then it's just always up from there. It's, you'll have good months and bad months, good days and bad days, and all that stuff. Just to kind of fast forward a little bit, I was in grad school, and typically for my depression, what would happen would be depressive episodes would come around. Sometimes they would be quote unquote triggered by something stressful, for example, or sometimes they'd be random, but usually it would come for about a week or two and then kind of drift away, which is pretty typical, to be honest. And one started around my birthday in May that year and just didn't go away. And, 2 weeks went by, 3 weeks, 4 weeks, 5 weeks, and it was just exhausting. It was a lot. And I just remember I went into work that day and started my, daily task, and I was just, my brain was just firing all sorts of just random thoughts back and forth, but I had this thought of like, if this is what it's going to be like, I don't want to keep going on like this. And that just terrified me. I would never say that I reached a point of actually contemplating any sort of self-harm or suicide or anything like that, but just that feeling of not wanting to be around anymore. And, thankfully I stopped what I was doing right away, because again, that was, very scary thought for me. And my therapist, by the grace of God, had an opening that day. Instead of me having to wait a few more days to go see her, I was able to arrange leaving work a little bit early to go to that appointment. I kind of let my wife know, like, hey, this just kind of happened, and I'm freaking out, but I'm going to go see, my therapist and all that. And all parties, myself, my therapist, my wife, we all kind of agreed, like, probably the time to look into medication. And so that's what I did. I reached out to my PCP.
So you had not been medicated
Correct.
Until this point. Okay.
Yeah, so for the first couple of years, for me personally, it was just the the talk therapy every 2 weeks or every month or however, depending on what exactly was going on for everybody involved. So that was the point where I was like, okay, medication needs to come into the picture. And thankfully, that it worked out really well for me. It can be a real journey, a real struggle for a lot of people to find the right one. I was very fortunate that the first one they tried me on worked for me.
Wow.
I don't want to name drop anything because, you should talk to your own doctor about any sort of medication. Don't listen to commercials. That's absurd that we can actually advertise for medicines in this country. That's a whole other topic for another day.
Different podcast.
Yeah. I'll come back in 2 months.
So you got medication to help as well. And that kind of a turning point in the journey?
It was. Again, it's never going to be a, straight line in any direction. Even with medication, what some people may not realize is that, it doesn't mean that the illness is going to go away.
Right.
It's almost like, think of it like a flu shot. So if you don't know how flu shots work, they try their best guess at what variants we're going to have up north in the northern hemisphere based on the variants that come first in the southern hemisphere for the year. And they're not always right. But even if you have the shot for flu A, B, and C, but you catch flu D, it's not going to be as bad.
Sure.
Same with, COVID vaccines, all sorts of that kind of thing. And it's the same for medication for me, especially, was like, my depression just didn't go away overnight. It didn't erase every depressive episode by any means, but it made them shorter, a lot more manageable.
Right.
It was interfering with work and life a lot less. And that's thankfully still where I am now. So
that's great.
Yeah.
So it sounds like another very important component to all of this was a support system.
Absolutely.
Right? You had your wife, you had a very available therapist, it seemed, a very supportive therapist. I mean, can you talk a little bit about how crucial that was for you and how critical that has to be for anybody struggling with mental health issues? Absolutely,
because I think you hit the nail on the head. I mean, without a support system, I don't know what I would have done. I mean, I don't want to be overly dramatic or make any assumptions, but like I don't know if I would still be here without all of that, especially with, again, my background and my support all being in place before I even had that terrible thought of mine.
Right.
And so without that, I don't know where I would be or if I would be here. Yeah. And again, don't want to go too far down the rabbit hole. That's not helpful for anybody. But to have anybody like a confidant, if it's a family member, if it's just one best friend, like having people that have your back is incredibly important because thankfully in all of my experience of opening up to people to say, hey, this is what I'm going through, or, posting on Facebook or writing blog posts and whatever else I've done in the years, like there have been exceedingly few instances where someone's reaction was so not good that I kind of backed away from the friendship. For the most part, I'm just fortunate to have surrounded myself with people that are already understanding and gracious people. So
was it a difficult process for you to find a therapist to work with you that well? Was it like the medication where you got what you needed and it worked for you?
It was, again, very, very, blessed in that regard that it was the same therapist that we had seen for, I think it was just really one of the final sessions of our premarital counseling.
Okay, gotcha.
We just really, our rapport was great and all that sort of thing. And again, I know that's definitely not the case for a lot of people. And on that note, I've seen so many instances where people will talk about like having a bad experience with a therapist at could be a young age, could be as an adult, whatever. and that kind of just scares them off of trying
Right, and
later.
refusing to try again. I've run into that as well at schools where the parents don't want to take them because they had a bad experience once. I think it is important for people to reach out and keep reaching out until you find someone you feel comfortable with.
Yeah, absolutely. I think we've even got a good friend of ours who's kind of ran the same situation where it's like, maybe it works for a while, but after a certain point, like whatever the dynamic isn't really working. And definitely, as Heidi said, keep reaching out and find that person that will work for you, because it's just as important as our physical health. I mean, I'm sure we've all talked to a medical doctor that we didn't exactly like their attitude or didn't think that they had a good bedside manner or whatever else. But, if you break your leg, you're not going to just tough it on your own, especially if it's, severe enough, so to speak. So in that same vein, if, your mental health is very important, and it even ties into your physical health for that matter. So definitely keep reaching out and finding that person that does work for you, because they are out there. And in the meantime, having that support system around you to help encourage you to find that person and be that shoulder to lean on, in the meantime. Emphasis on in the meantime. Because that's another misconception, too, is that people can kind of misconstrue things that are therapeutic with things being therapy.
Sure.
It's like, oh, well, I don't need a therapist because, my girlfriend's a good listener, or my boyfriend's a good listener, or I always talk to my mom every day. Well, that's great. And that should not stop by any means. Again, support systems are very excellent, but that's not a replacement any more than, I talk to my mom every day, but my leg's still broken.
Yeah, that's a good analogy. It's interesting, though, you talk about, talking to a boyfriend, girlfriend, family member, whatever. It does sound like talking to your wife. That, at the very beginning, that was also very crucial to bringing the depression to the light.
Mm-hmm. Absolutely.
Because I think I recall you saying that she asked point blank,
yes,
do you think you might be depressed? Do you think that you might have realized it on your own if she hadn't brought it up, or if it would have been a long time before you might have realized, oh, I might have depression?
For me, at the point that I had gotten to that day, I think it would have dawned on me pretty quickly.
Yeah.
Within a couple of days, if not that same day. I'm even so people-pleasing, apologetic. I literally, I still make fun of myself to this day. I literally went and, after I'd already called into work, logged in to send my manager an email, explaining that this was a mental health day. That was not a requirement by any means. And I mean, I still talk to him. He's great, and he was very gracious about it, and he was very supportive of that, as was everybody that really had anything to do with my my employment at that job, and I'm forever grateful for all of them. But that was that was how apologetic and how self-aware. I was oh, this is such a problem that I need to let them know, because if I don't, then those depressious and anxious thoughts of just running oh, I'm gonna get fired if I don't let somebody know what's going on, because obviously missing one day of work in this 6-month span is grounds for termination. Right. Said very few people ever.
It sounds like you've had a lot of support along your journey, but are there a lot of misunderstandings out there that you've seen with people when it comes to mental health?
Absolutely. One of the things that I'd heard, and I want to be clear about a few things, some of the things I'm gonna mention about that weren't helpful for me or were misconceptions, like you just mentioned. Those don't make somebody a quote unquote bad person. It's just, again, people don't always know what to say in these situations, because it's not a comfortable. It's not a comfortable conversation.
And it's something that's not talked about very often. People aren't accustomed to bringing up mental health issues.
It's bringing up a weakness. I think a lot of people avoid showing their weaknesses.
Exactly. And so one of the things I would hear a couple of times is oh, so well, what are you depressed about? Well,
I don't understand your question, sir.
I don't understand the question, and I won't respond to it. But and again, that's one of the misconceptions that I'd even kind of jotted down as we were discussing what topics to bring up, is that what's tricky about mental health is that everybody has thoughts, everybody has emotions, and most people are going to feel depressed at some point in their life. Most people are going to feel anxious at some point in their life. If it's the loss of a loved one, if it's the test that could determine if they get into medical school or whatever. Like, there are so many situations that bring out these very real and very valid emotions, but having those emotions for a situational reason is not the same as having a clinical diagnosis.
Right.
And that's where the fact that the terminology is very similar, is almost identical, really, I think kind of plays into that again, when you hear, okay, somebody has clinical depression. Okay, well, when I had that really bad breakup, that was really rough. And there was a couple of weeks where I really couldn't get out of bed. Or, when I was so close to my grandpa and I cried for days. And if that's the only way, if that's their only...
like their only reference point.
Yeah, reference point. I was like, what's that word?
For depression, yeah.
Yes, if that's the only reference point, then of course that's where their mind's going to go to. And again, it's not a fault of theirs. It's not like you're a mean or bad person for asking those questions.
Sure.
But that is certainly one of the big misconceptions, is that like, oh well, sometimes that leads to, okay, so this person should be over it in the next couple of weeks, right? Because I remember how bad it was for me, and it was rough, but yeah, give it another couple of days and you'll be fine.
Yeah, I got over it.
Yeah.
Yeah.
And of course that's not the case. And for physical illnesses, a lot of times it's not quite the same, where we all have thoughts and feelings. Not everybody's had a broken arm or a broken leg or cancer or heart disease or any of these other things. So like, those are very a lot more hard and fast, like yes or no.
Right.
Not universal experiences, whereas emotions and negative self-talk and all these other things that these bad thought processes probably happen to most people, if not every single person, but just not always in the clinical diagnosable way.
Sure.
And everyone copes at a different pace, for different reasons. Like, the same thing that would upset me might not upset you, but it might upset you. Everyone reacts differently to different situations.
Yeah. Well, and there's not a one-size-fits-all remedy.
Right.
I mean, for a lot of things, but we, like you said, we try to treat mental health in that way. Like with depression, it's like, oh, just give us some time, or think happy thoughts. Do
I hadn't thought of that. Thank you.
Oh, just don't be depressed. Oh, don't be depressed. I never thought of that before.
Yeah, just don't do it.
Yeah. And so I think the problem there is that people have a basic misunderstanding of the severity of like clinical depression, because, like you said, people think about like, oh, I was depressed for a little while, and that's the same. So how have you tried to incorporate some of your experiences into helping others, like in past jobs, other work in mental health? How have you been able to frame that experience to help others?
I think that was definitely, gave me some sort of an advantage, for lack of a better word, for talking to certain people, because, and I'm so glad that you mentioned that, Heidi, that, everybody's going to go through things differently. I mean, just to use my wife as an example, she went through the exact same situation that I did. We both woke up to that flood. We both lost our cars. We both had all these things happen. Yeah. She did not end up needing to go to therapy to sort things out. And that doesn't make me weak or her better or anything like that. It's just how our brains operate differently. And to that end, like, I would always try to throw that caveat in there if I'm talking to somebody that's mentioning their depression to me in that clinical setting of like coming to my previous work for help. And if I felt that the rapport was there and that it was appropriate, I would, again, state like, I'm not going to compare my situation to yours, but I do know, at least to some degree, I have felt the same way before. One of the, with anxiety as well, some people may already know this, like depression and anxiety kind of go hand in hand a lot of times. Not every time, but a lot of times. For me, it was, depression was, the 75%, and then anxiety was maybe 25% for my specific diagnosis. And they kind of go hand in hand in a nice little downward spiral sometimes for people.
Lovely.
They hold each other's hand as they skip down the road.
And one of the things that I feel like was so easy to convey with words and to commiserate with somebody was like tying it into the physical symptoms of mental health. Like when you get for me with these like certain levels of anxiety, I mean, it's like, you ever try to just take a dish rag and get every single drop of water out of it?
Mm-hmm.
It just feels like my stomach was doing that.
Yeah.
And like, there was literally multiple occasions where I had, thankfully not too many, but more than one occasion where some thought would just get buried in my head, and I didn't quite have all the tools yet to effectively fight it back. And I mean, I would literally get sick at work because of how it like intense my anxiety was, and just twisting my stomach into knots, and like, yeah. And that's something else I don't think people realize. Like, there are so many ways that all of these different mental health concerns can show up for some people. It's not always, crying at the freezer door. It's not always, throwing up from the anxiety. Like, it looks different for different people. Like, if we had me and 49 other people all in here talking about depression, we probably have 50 different stories about how exactly we dealt with it and how exactly it showed up for us.
Well, just so people can have a little bit of a reference point, again, bearing in mind, mental health issues look different for everybody. What are some of the most common symptoms, behaviors,
things to look for,
to look out for for mental health?
For speaking to like depression, I mean, again, some of these are the ones that you may think of already, but just completely just what they call anhedonia, just losing interest, like nothing seems like worth doing. Not necessarily that maybe you can get out of bed, but all your hobbies just don't interest you anymore. It could be even related to things like sex drive or hunger and all that kind of stuff. It can swing in both directions for a lot of things, honestly. Some people may just not stop snacking, and some people may like skip entire meals. And with anxiety, like not being able to get these thoughts out of your head, and letting those thoughts kind of hinder your daily activities and your daily, like, what you need to get done during the day. Like, oh, well, I remember them talking about me behind my back, 2 months ago, so I don't want to go to work today because they may say something else. Just as a random example of like, just kind of trying to keep an eye on that. And one of the biggest things is that needs to be more common and should be taught in schools, really, is to be able to be in touch with your emotions and identifying them in general.
Right.
Because that's one of the things with what they would call mental health literacy, is knowing those signs and symptoms that we're talking about, knowing what can cause those things, and also knowing what they're called. I liked how you said, like, bring that depression into light when my wife brought it up. Like, once you put a name to something,
it's not as scary anymore.
Right.
In a way.
It gives it, something that you can identify and something that you can work for or against, or whatever direction you want to take with that. I think I think in the past we've used the example of like, Voldemort, like,
don't say that name.
I know. Sorry.
He who shall not be named.
Right. And like, avoiding calling it something, like, giving it little nicknames or, euphemisms or whatever, like, to skirt around the issue. That's not helping anybody.
Right.
Like, it's depression. It is what it is. Like, if I can say it, you can say it.
I'm really glad you just said it is what it is. It's depression. Like, you can talk about it, because I'm a people pleaser by nature. I don't like making people feel uncomfortable as much as I can help it. And for the longest time, I would have thought like, oh, I shouldn't bring up Jordan's depression because it probably makes him sad, like he probably doesn't want to talk about that because it's a sad thing, and I don't want to make him feel sad or uncomfortable. And I maybe the motivations, I'm sure, are different for a lot of people, but a lot of people are probably really hesitant to bring up mental health, and I think they could use that mentality. It's a thing, like it's real, and it needs to be talked about.
I'm so glad you said that, because they've done the research, and people had that same fear for a long time of like, I don't want to bring up the topic of suicide to somebody because I'm afraid that may put the idea in their head, or they may do something. The research says the opposite. If you ask somebody, are you thinking of hurting yourself, or are you thinking of, taking your own life, that does not increase the risk of it happening. If they're having the thoughts, they're already going to be there. That actually opens the door for the conversation to happen, and for them to for you to help them to get help and whatever else. And, I've, even as somebody, with depression for, it's literally been 7 years now and some change since I started therapy. And, it's somewhere along the line for a long time. I still had that same kind of thought of like, if somebody went through like a personal tragedy, like, we had a couple of friends of ours that unfortunately had like pregnancy losses, and, you want to check in on people, but you don't want to bring things up. But in that kind of circumstance, or in a mental illness circumstance, or even a physical illness circumstance, like, you're not going to bring it up. It's probably already somewhere in their mind anyway.
Right.
Do you have any advice on how to approach that subject with someone, or how would you want me to approach that with you? Just come out and say you're checking on them, or is there a kind way to do it?
Yeah, I think it can vary from person to person, and what each person's comfortable with, like how close they are to that person.
Mm-hmm.
Of course.
But honestly, like, I think you even just said it a moment ago, like, even just saying like, hey, I was thinking of you, I just wanted to check in, like, if you want to talk to me, I'm here. If you want to grab a coffee, I'm here. Like that sort of thing of just making your presence known.
Mm-hmm.
I can't say how much I appreciated it when I would let people know, like, oh man, it's kind of rough right now with my depressive episode or whatever. And then like 2 days later, I get a text like, hey, like, just wanted to check in because I know it was kind of rough for you the other day. That kind of stuff is like, oh man, it's so great, and it's so very much appreciated, and people want to know that you're thinking of them.
It's your support system, right?
Exactly. And even if it's not like your main support, even if it's somebody that you haven't like been able to physically see in years, like, your support system can be anybody. It doesn't have to be, for some people, I know like a lot of people may not have a close relationship with their family. But if they've had like a found family, so to speak, or, a close coworker or anybody that you trust, I would definitely, encourage you to, if you're having any sort of struggle, to reach out to those people, because as important as it is for, as Bobby mentioned earlier, for people to come out and talk about these sort of issues, we've had even, was it just like a week or two ago, even Jonah Hill was talking about, he's like coming out with this documentary about his mental health journey, while also saying like, you will not see me on the press junket for anything in the foreseeable future because it is awful for my anxiety, so I'm just not going to do it. That's fantastic. Good on him. Like, not only for like making a, speaking out about it, but also like taking those steps. I mean, there's been plenty of celebrities lately who've been either coming into the spotlight to say like, hey, I struggled with this in the past, here's how to get help, or who was saying like, hey, XYZ is not good for my mental health, so I'm taking a step back for a moment.
Yeah.
And
it's identifying those things that are right for you and then following through on that plan.
Absolutely.
Yeah. Do you have advice for people who need to reach out? Like, how do you find that support?
That was like, as I was even saying that just now, I was like, where was I going at that point again?
Heidi's got you back on track.
She does. Thank you, Heidi. All of that was to say like that. Don't feel obligated, like, oh, well, this person, well, they're my friend, so they should know. Like, that's not necessarily the thing. Like, if you feel that you trust somebody with those kind of things, then those are the people that you should reach out to first. Even as much as I love my parents and as supportive as they are, it was a month or two before I kind of said, hey guys, I'm kind of going through some stuff. Like, other people knew first, not that I like, told everybody but them, but, it's, everybody's going to have a certain comfort level of like, I'm more comfortable talking to Bobby before I say anything to Heidi, because, I mean, look at her, She's just so judgmental on that. I'm kidding.
Yeah, trying to tell you what to talk about.
Yeah. Getting me back on track.
Do you feel like you put your parents off to protect them in any way?
Not necessarily.
Okay.
It's just one of those things where it can just be hard to talk about,
Yeah.
And again, because of the nature of the beast, you worry about people's reactions. And again, and that's why I come out and say like, hey, if you go to therapy, you should make a Facebook post about it. Like, that's not how that should go. And even our the patron saint of mental health and social work and all that, Brene Brown, she would tell you that when it comes to sharing your story, like, there should be certain parameters of like, what is your real motivation behind it,
Mm-hmm.
and all that sort of thing. Are you actually trying to help, or are you just trying to, like, do you feel obligated? And it shouldn't be an obligation thing. It should definitely be like, these 3 or 4 people, like, I know that they've been there for me in the past, and I've been there for them, and that they can help me through this. And once I'm at a better place, I can start reaching out to more if I feel like I need to, or if I. Sometimes you may feel obligated, like I, for whatever reason, did to tell my boss on the first day of my rock bottom. Hey, man, this is a mental health day. See you on Monday.
Well, it's kind of like what Heidi was talking about before. I mean, it's been misconstrued as just a pure weakness, right? Like, oh, you're mentally unstable. You just can't handle a hard thing in your life, and that's not true at all. Because I think there are a lot of people who probably have mental health issues undiagnosed because they just did not want to. So well. Yeah, well, they hide it. They would never want to admit it for a variety of reasons. And you made me think. I would imagine it's hard for some people to tell parents, friends, but especially parents about something like mental health, because there could be a fear that it's a reflection upon how the parents did, and it's not.
Right.
I mean, usually. You know what I mean? In most cases, it's not at all a reflection on the parents. But I know if I found myself in that situation, that thought would go through my mind. That'd be like, man, my parents are going to think that they didn't do a good enough job raising me. And I think that's a natural fear to have. What kind of helped you cope? Or get to the point, maybe not cope might not be the best word. Get to the point where you felt comfortable talking to your parents about it, or breaking through those barriers where you might have felt uncomfortable talking to people.
I think part of it had to be that I needed to, work on it, in the sense that, they weren't my boss. They weren't going to get that email the very first day that it happened. Once I was in therapy for a month or two, and I kind of started to get some, more understanding of what it was for me, and also how to kind of fight back against it.
Yeah.
Because again, like, it didn't matter in that way. It didn't matter that I had a degree in the thing. It didn't matter that, I had friends who'd gone through, objectively more severe instances of mental health. It's still, it's something that everybody needs to figure out for themselves through that therapy relationship of, like, how is it affecting me, and what are the things that my mind is going through that are making it better or making it worse, and how to, lean toward the former and fight against the latter. And so once I kind of got to that point, I had kind of reached, that was actually, honestly, that was one of the times that I'd gotten sick at work, was like, I had this thought of, like, I really feel like I should tell my parents about this.
Yeah. And,
like, but then the downward spiral of, like, what's their reaction going to be? And of course it was a positive reaction, because it was, I trust my parents not to tell them, so we have a good relationship. But again, that's sadly not the case for a lot of people that I know. But getting to that point of identifying what it was doing for me in my life, and having some coping skills under my belt before I started telling more people. But again, going back to so many of those things, talking to people about it is therapeutic. Listening to music is therapeutic. Going, taking a walk outside, exercise, diet, all, like, your faith in, in God or whatever your faith is. All those things can be helpful for you in a lot of ways, but that doesn't make them a replacement for, like, professional help. And that's, again, the thing where some people do only have that situational brief moment, and when they did one or two quick things, it did turn it around for them, and that's fantastic for them. But it's just not a universal, fix-all. It's not a universal Band-Aid.
Hey guys, we hope you enjoyed part 1 of this discussion on mental health awareness. If you're wondering why we made this into a 2-parter, we try to keep all of our episodes under an hour. But our conversation with Jordan was just so dang good, we wouldn't have been able to fit all the content you want to hear into an hour-long episode. Hence, part 1 and part 2. Stay tuned for the release of part 2 in a couple of weeks, and don't forget to subscribe to us on YouTube, follow us on Spotify, and check out our Facebook and Instagram pages. Thanks for listening, and we'll see you next time.